Parents of a 19-month-old baby boy, Praise and Mimi Mumbo, says their child, Jeremiah, contracted HIV following 2 blood transfusions at Safe Bliss Medical Centre, a private hospital in Benin City. According to the child's father, Praise Mumbo, he said baby Jeremiah was first admitted to the hospital on February 6, 2025, with high fever and a critically low blood level. With the packed cell volume PCV reading at just 11%, the hospital advised an urgent transfusion and blood worth 40,000 naira was purchased and administered. The family returned to the same hospital on May 3, 2025 for a second admission. Once again, the hospital recommended a transfusion. Mr. Mumbo says that although he and his wife offered to donate blood, the hospital allegedly declined, citing unavailability of lab personnel to screen it. They were instead asked to purchase another unit of blood for 35,000 naira. He said his family was devastated when doctors at the government hospital later told him his baby had HIV as he appealed for justice for his son.
When my baby temperature was very high, which is this year, February 6, so we took him to Safe Bliss Medical Centre along Sloko Road. So when we get there, they do all the necessary tests for his body that he have a PCV is very low and he have fever and temperature is very high. So they do both HIV tests that day. And when they do the test, HIV test, which is ROVS, show negative. It show negative. And after they do the test finish, that they need to give him blood. And I suggest that I should donate my own blood. They say that there are lab scientists not around that they can take blood from me, and it will take a long process. That the baby temperature is very high and is according to a condition that they need to buy blood the faster way. So I don't have choice because the baby condition, I was very scared at that moment. So I now make a deposit and they bring the blood within some minutes. If I'm not mistaken, it's not up to 30 minutes. So they bring the blood. After they bring the blood, they transfuse the blood on him. After they admit us and transfuse the blood on him, they give him the blood twice.
Following the diagnosis at the government hospital, the couple filed a formal complaint with the Edo State Ministry of Health and the Office of the Attorney General, alleging negligence and unsafe medical practices.
I received a petition from the parents of that young child. We are going to make sure that we follow through that matter to see that justice is done and put squarely the blame where it should belong.
In response to the allegations, the Edo State Commissioner for Health, Dr. Cyril Oshiomhole, confirmed that Safe Bliss Medical Centre has been sealed. He said investigations revealed that the hospital was operating without registration. Dr. Cyril Oshiomhole said preliminary findings show that the blood donors tested HIV negative as of July 28, 2025. He added that the parents have also been screened.
We seal up the hospital. The donors, we've taken their blood sample. They were both HIV negative. This is horrific. I wouldn't wish that for my enemy at all.
As at 28th of July 2025, attempts to get a direct comment from Safe Bliss Medical Centre were unsuccessful. The hospital directed all inquiries to their legal counsel, who stated that a public response would be issued at a later date. Meanwhile, in a follow-up interview at the Ministry of Health on Monday, 4th August 2025, the spokesperson for the Mumbo family, Honourable Enos Mumbo, said the test results of baby Jeremiah's parents are out and HIV negative, and that they are looking towards a peaceful resolution.
On the part of the hospital, they were at the defensive ends, especially the administrator of the hospital, who felt that the image of the hospital is much more than the life of the child.
Reacting to the latest development, the administrator of Safe Bliss Medical Centre, Esosa Benjamin, extolled the effort of the Ministry of Health. He cited that even though the hospital has been exonerated by the outcome of the test results of the donors, they still looked forward to settling the matter amicably.
The report from the investigation they carried out so far showed that the donors through which those bloods that were transfused to the patient was negative. And that shows that the blood that was transfused was negative.
On his part, Dr. Oshiomhole said, due to previous investigations, they discovered that baby Jeremiah is a sickle cell patient and that more findings are underway until 11th of August 2025.
The child is a sickle cell patient, and that shows that the child will always have most likely blood transfusion from time to time. I'll personally go to the blood bank myself to check for the original copy to make sure that this register was not doctored, because it also shows that the donors are HIV negative. But I want to be sure that those donors were not swapped and those are the actual donors. But that's not to say that the hospital is completely exonerated, so they owe them the point of duty of care to see how they can assist the child. But we convene a week from now, 11th of August by noon, to see how we can conclude on this matter. If we don't have closure, then we have to take the matter to court.
When I first see this particular video, I shed tears for an innocent child, a 19-month-old baby, to be infused with HIV as in during blood transmission, allegedly. It is heartbreaking. My question I say, when we will even they do something right for Edo State? When? This is the result when you have incompetent people. People will be like say that they forbid professionalism in carrying out their practice. This is what you get. An innocent child, a 19-month-old baby, to be infused with HIV during blood transmission. Tell me what it will take for them to, do you just infuse blood into people without first of all carrying out a proper test of the blood before you infuse the blood? And they are coming out to tell us that the donor of those blood are HIV negative. And the child, before the transmission of the blood, the child was negative. And now the Commissioner for Health, Cyril Oshiomhole, is telling us that after the whole incident has happened, now it is now that they are carrying out a proper check on the competence of the hospital, and they find out that the hospital is not even registered in Edo State. So you guys are telling us that it is when something like this happen before you guys will not start carrying out a proper check. So this is my advice to every Edo person. Be very, very careful, because you see that this same administration, theirs is just to be active. There is nothing like a proactive measure. They are just active. So you don't be the scapegoat in order for them to be active. They are supposed to be an administration that is very proactive. So it is now that the child has been infused with HIV. I feel very sorry for that. I cry when I first see this video. And it is now you guys are carrying a proper check of Safe Bliss Hospital. It is now you are carrying a proper check, and you now find out that the hospital is not registered, and a young child is going to suffer his life carrying a diagnosis of HIV all his life. All his life. Because of blood transmission. As little, say maybe as simple as it can be, the father even volunteered to even be the one to donate blood for his child. You guys were saying you cannot wait because the people who are to carry out the blood test, they are not around. So there is no time. So you went to go and carry blood from nowhere or from your blood bank, and you just infuse without even still carrying out the check on the blood before infusing. When we go even do something right, that's also yeah news we go the year. And now the commissioner is coming out to tell us, Commissioner for Health, that it is now they are carrying out the check of the hospital, and they find out that it's not registered. It's not registered. It is well. My advice to you people, before you go to hospital in Nigeria, in Edo State, shine your eye. When you are in that hospital, shine your eye. Don't just allow them do anything. Shine your eye. What kind of careless mistake is this? I just want to add my voice. We need justice for praise, Momo. Justice. Justice. Because they cannot tell us now that the child that was negative before transmission is now positive after transmission. And they are telling us the donor of the blood is also negative. How come? We need explanation. And we need a follow-up on this matter. Very important. My God. Such a young child, 19 months old baby. It is well.